All right. Task force, you're welcome, co-chairs, you're welcome to jump in and get this show on the road. I know we have a lot to cover today, so excited to be here.
Thanks, Sarah. Very excited to see everyone here. Everyone, thank you for coming, for taking the time, for being a part of this. So welcome to everyone. I'm going to start out with the land acknowledgement, reading of the task force purpose. We'll get those meetings approved, and to go to community shares and shout outs. And then after we get that done, we'll head straight into the agenda. So start out with the land acknowledgement. I would like to begin by acknowledging that we are here today on the ancestral homelands of Indigenous peoples who have lived in the Salish Sea Basin and the North Cascades watershed from time immemorial. In particular, the Lactamish people, who we recognize today to be the Lummi Nation, the Nooksack tribe, and Semiahmoo. May we be mindful of the inherent owners of this land, our children, who are our future stewards of the land and advocates for the generation to come. May that truth guide our work and efforts to improve the well-being of all families and children, native and non-native, living in this beautiful country. Actually, county. It is a beautiful country, but we have an especially beautiful county. This land acknowledgement is not meant to be a substitute for authentic relationship building and understanding. It is meant to introduce us to one way we can show respect and honor for the sacrifices of the first people of this land. Please join me in expressing the deepest respect for our Indigenous neighbors and gratitude for the enduring stewardship of our shared lands and waterways. And as a reminder, the purpose of our task force is, I always have it on multiple screens. The purpose of the Whatcom County Child and Family Wellbeing Task Force is to continually review Whatcom governmental impact on children and families and make specific recommendations for improvements for all departments. All right, so I'm going to ask if there are any, if we could get someone to make a motion to approve the minutes, and then someone to second, see if there's any discussion on them, and then we will take a vote. And I believe it's better if you put your vote in the chat. So any motion to approve the minutes from the last meeting?
I move that we approve them.
I don't know who that was.
Sterling, sorry, Sterling's in our room.
Oh, okay. And I think Beverly, were you seconding? Yeah, a
Oh,
second.
I was absolutely seconding because I knew Sterling was going to make the motion.
Oh, and we don't, Vessa's letting me know we don't need to make a motion.
That's great.
But it's fun. It's fun to pretend we're in a big fancy legislative body. Okay, let's vote yes or no to approve the minutes. Oh, any discussion, any change, any comments on them? All right, yes or no in the chat. We don't do fist to 5 on this.
I go yes too, John.
Yes.
Okay, great, thanks. Is that what you're taking notes? The big votes. Yeah, a big thing for us both. Oh my God.
Sarah and Kerr, you guys good on the votes? I think we have enough to approve.
Oh, yeah. Yeah,
Okay.
sorry, I just forgot that Beth is also not here and that we are also managing the vote, so, but we've got it. Carrie Ann is in here taking control.
We have full faith.
Yeah.
All right, let's go to community shares and shout outs. Beverly?
Hi there. I just wanted to have a shout out to other community partners who were at this, and to the congregation at the Guru Nanak Gurudwara, the Sikh temple out on Pole Road. They had their first ever community resource fair yesterday from 10 to 3, and they made sure that we had beautiful weather so that we could connect with families and parents and children. Folks of all ages were there. There was staff from domestic violence, from Opportunity Council, myself from the ARC. The YMCA had the biggest hall because they could just say free swim lessons and offer that to anybody. But it was just a really great showing of community resources and a wonderful welcome from that community.
Okay, that's gonna be hard to beat. Anybody else? Okay, I'll add these couple of community share. This is a shout out to New Mexico, if I got it right. I think they
Yeah, you
implemented.
did. Yeah.
So I'm shouting out to our larger community. I am shouting out to Canada. I had this amazing conversation with someone that is Canadian who's in this field, who was telling me about their amazing Family Leave Act, kind of underlying the same points that we're all dealing with here in childcare, but they're doing a bit better job. So shout out to them. So globally and nationally, and Christina has.
I do. I just want to, I don't know if this is a shout out or I don't, whatever it is. I just want to let everybody know that starting next month, the SUD training that I do rolls over and starts a new 8-week session. And instead of being 16 hours in 1 week, I have changed it to where it is 2 hours a week for 8 weeks. And you can either do a morning or an evening. You can, if you can't do it in the morning, you could do it that week in the evening. And it doesn't have to be consecutive. So there will be like several times throughout the year that you could retake it. If you take all of them, you get a certificate. And I'll put the link in the chat.
I too as well, Sally, whenever you get a chance.
Do it.
Okay, great. One is tomorrow morning at 8:30 in the morning. Ferndale's Early Learning Center is having a ribbon cutting for the all accessible playground that ARPA funded and our staff have been staffing, and we're so excited to celebrate them. It's pretty huge. Young people who are wheelchair bound can play with those kids who are not, and we are just more than excited to be there to support that project. And our videographer will be there as well to kind of highlight and share with the community members who won't be able to be there. And then additionally, I'm putting on my Susan Marks hat. I hope this is okay, Susan Marks. Susan and her team planned the Whatcom County Summit on Missing, Murdered, and Indigenous Women, and our team went last year, and it was outrageously informative, and the agenda continues to look so. And so we know that the link is live now to register. I hope it's okay, Susan. Okay, great. I'm encouraging folks to attend, but it's something that we really got a lot out of, and I know we will again. So we hope other folks will join us.
And I believe next week there is the All Hands Whatcom Summit as well, which I bet.
Oh, yeah.
We're going to. I am, yeah.
That's this week.
Mm-hmm.
That's Wednesday and Thursday of this week.
Oh, glad that someone corrected me on that. Thank you, Christina. Okay. Well, we're at 3:42, so I am going to hand this over to Sarah to give us an update on the Healthy Children's Fund.
Oh, great, thanks. And I only have 5 minutes, so I'm going to take some advice from Vesla, where last time I was talking to everyone, she said, could you please slow down? So I'm gonna try and be as slow as possible with the 5 minutes I have, but know that I encourage you all to read the report as well, because it was meatier this time than last, I think. But in general, I want to share kind of in our general Healthy Children's Fund narrative that the capital RFP and our subsidy RFP are still live. Capital closes tomorrow, and I'm extremely excited to see the applications we're receiving from that. And then our subsidy RFP closes in early October, but looking forward to that. As well, you know, the Healthy Children's Fund, you can see the link that I provided in the in the report, but it just has a general link to all of the active contracts that we have, so you can see what we're up to. As well, I was planning to present on September 23rd to council, but it had to be bumped because they have such a big workload. And so instead it's going to be an email, but it's essentially an update to the meeting that I had with them, the special council meeting that we had with them on July 29th, and just reassuring them that their top priorities actually already happen to be the top priorities in the implementation plan, which is pretty exciting to see that overlap. And that starting October 1st, and I do have an edit on your report, it says through the 22nd, but October 1st through October 17th will be an open period for community members to respond to their questions, critiques of the current draft implementation plan. And we're looking forward to receiving that. And so following that public comment period, the Healthy Children's Fund team will review the feedback, identify key themes, and then we'll present them for discussion to the Child and Family Wellbeing Task Force Subcommittee for the Healthy Children's Fund happens to be that the 20th, which is all perfect timing. And so we'll share that feedback with that group, as well as the implementation team as well, before we present the final draft to County Council, that first meeting in November. I don't have any staffing updates. It was exciting because we're fully staffed. And then last month, I provided you all with an evaluation update. It's kind of our annual report that Hunter, our evaluator, and my team put together through both surveys done with members of this group, our advisory group for evaluation, and then also implementation team members. And so happy to share more about that with you all at the next meeting when I have a bit more time, but I encourage you all to look at that internal process evaluation that we produced. And then in terms of outreach and communication, as you all know, we've hired a videographer. We've already had 2 videos posted. I have another 3rd one coming soon. And like I mentioned, the videographer is joining me at the meeting tomorrow. And we're hoping to do actually a highlight of all the programs being launched in Ferndale, because we have some really good things happening there amongst many organizations. So those are just kind of my general updates in the time I have today, but feel free to reach out, of course, if you have any questions. Send me an email. I'm happy to follow up, and I imagine I'll have more time at the next council meeting to go in a little deeper, but happy to answer any questions as well in my last minute or so.
Sarah, I have a question.
Yeah, please go for it, Vesla.
What is the general kind of outreach plan for the public
Mhm.
comment?
Great. Yeah, great question. So there was a list of, and I'm sorry, I don't have it in front of me. There's a list of groups that the implementation plan wanted us to send the plan to, with the comment link that will be posted on our Whatcom County website. Those groups do include like the group that Susan manages with the Domestic Violence Coalition, Healthy Whatcom, PHAB, Business and Commerce, the Small Cities groups, Healthy Whatcom, the implementation team, of course, the Child and Family Wellbeing Task Force. And so all those groups will receive kind of a special invitation and a reminder that the open comment period is open for the designated period of time. I also plan to send it to county council members, and then we hope to do a little PR push on our social media and other tools that we have within Whatcom County.
Thanks, Sarah. Is there a way to give that information to the folks who have signed up to give their email addresses through the rapid survey as well?
Oh yeah, I think that's a good question. I'll have to look and see what the rapid survey, what it says they're acknowledging when they give us their email address. I can't remember, if I'm honest, if it's just like you get to receive data back. I mean, of course, our newsletter will receive the information, but that's a good question. I'll have to look into it. I'll report back.
Okay, I don't see anything else in the chat or hands raised, so I am going to go ahead and turn this over to Jill to give us the Healthy Children's Fund external audit update.
Hi, everyone. Happy to be here. Hopefully you can hear me okay. So I am following up on the packet that went out to the task force in your August meeting, announcing the external audit process. And then also, I think I forwarded the the proposal from SIVA Workshop. And so we have invited SIVA Workshop to be here today to just walk through their proposal, kind of show you how they're planning to engage in the audit. We've already started giving them lots of information to start doing a desk review on. And so here today with us is Vivian Savath, and there's so many people I don't have my thing where I can see her face. But we're gonna turn some time over to her to introduce themselves, to have answer any questions that you may have for them as we start working through the audit, and that'll be completed by the end of this year. So,
Thanks, Jill. I have some slides I can put up here.
okay. And hopefully, are you able to share, or that might be Sarah giving you permission?
Yeah, I just sent a share request.
Okay.
Okay, looks like it's all set, ready to go. All right, thanks so much. It's really great to be here with you all. Like Jill said, my name's Vivian Savath. I work with a Seattle-based firm called SIVA Workshop, and we will be conducting the external evaluation of the Healthy Children's Fund. Today, I'll just introduce our team a little bit, go over the general scope and charge, and we'll talk a little bit about the timeline and the activities that we have lying ahead of us for the external evaluation. And then I hope that we'll have some time at the end of my slot for a little bit of discussion as well. So we are a firm of about 11 people. Our focus is community planning, policy analysis, and evaluation. I'll be project managing, and I lead policy and evaluation at SIVA Workshop, which really runs the full gamut of process and program evaluation, sometimes impact evaluation. And we've also done work, for example, with the state auditor's office on performance audits, which is great because I think our scope kind of combines some of these charges. I'll be supported by Hannah Rubens, who some of you have met, as well as Diana Herring, who focuses on quantitative data analysis as well as GIS work. So as far as the scope and charge, the foundation of this is really the ordinance that established the Healthy Children's Fund. And there's this overarching goal to ensure that taxpayer money is well spent to achieve the goals as adopted by County Council. Your role is also prescribed in the ordinance to be part and collaborators in designing this audit process. So that's one of our key goals today, is to hear your input on the audit process. And then we will also be coming back to this group to talk about key findings in the draft period before submission to the County Council. The ordinance also establishes that this audit and external evaluation will happen every odd year. So it's kind of an every 2-year process, and this is the first time that it's happening. Kind of a little bit more detail about the parameters of the external evaluation come from the RFP and our scope and contract. So I did want to highlight these kind of parallel objectives. So one is really focused on performance of the fund from kind of a fiduciary standpoint. How effective have the Healthy Children's Fund monies been spent? As well as a process evaluation that is more kind of a reflection on recipients and applicants' experience working with the county, what barriers were encountered. And this is really all with the end motive of finding opportunities for improvement. So that could be in administration, program design, it could be reallocating investments. And obviously the implementation plan is a great opportunity to put some of these recommendations into action. I believe you are all familiar with the questions, the specific questions that the external evaluation is intended to address. And these are drawing from this results-based accountability framework. that the county has adopted. So these first three boxes, really thinking about how much did we do? So some of those key questions are, you know, how much money went out the door? Where did it go? How many children, parents, expecting parents, how many people have been impacted by these funds? The yellow box really addresses kind of the how well did we do it. So here we're investigating some questions related to process, and for example, the process of selecting grantees and how equity appears in the experience of the fund. So how equitably were resources distributed? So these are just example questions that we pulled out. I think you have probably seen in the scope that there's a longer list of questions in each of these buckets. And then finally, the gray box talks about, is anyone better off? So some of those longer term outcome questions, to the extent that we're able to identify, have we achieved the goals of making mental health supports more accessible and available? For example, what kinds of outcomes are we observing in the early childhood workforce? And then there's this fourth category of stakeholder feedback. And basically, how was the user experience? What was the experience for providers in accessing and implementing funded activities? What kinds of things can we measure and observe related to morale, workload, or job satisfaction since the inception of the Healthy Children's Fund, et cetera? So how do we plan to answer these questions? Here we have laid out some of the key audit activities that are going to be unfolding over the next couple months. So one, just so you are all aware, that we'll be checking in with Jill every Tuesday for an update on progress, and Jill is helping us coordinate access to some of these data sources. We're also coordinating directly with staff for data requests and help interpreting data, as well as accessing some providers and other staff members for interviews. And then also checking in with you all. So task force briefings are also planned throughout the audit period. The green line will be reviewing financial data and document review. So this includes budget documents and the general ledger to see how budgeted funds compare to actual expenditures. We're also reviewing those expenditures against what's written in policy in terms of the expected distribution of funds. For these, we're obviously relying on the ordinance and implementation plan. We're also going to be doing a deep dive sample of 8 contracts. So we've already worked with staff to pull a sample of 8 contracts that kind of represent the breadth of experience with the Healthy Children's Fund. So some small contracts, some large contracts, some very recent ones, and some really the first contract that was established, and then also looking to have a spread of contracts across the implementation strategies. So there's 8 contracts that will kind of get a deeper dive where we'll be following up through the RFP and selection process and interviewing on the provider side, as well as looking at some of the grantee reporting data that's a requirement of their contracts. We're also planning qualitative work, primarily planning to interview staff, providers, as well as users and beneficiaries of the fund, so families themselves. And obviously there's the work of the analysis and deliverables development. So there's one key milestone we wanted to highlight is having a staff workshop towards the end of November to reflect on these findings and really identify feasible ways to make improvements, as well as the draft report, which will be going by this task force as well as staff, and the final report. So we have about 4 months to complete this external evaluation. So these activities are going to be kicking off in full force, and work streams going in parallel. So a couple of things we wanted to highlight today is we've got 30 minutes to talk about the work plan and get your feedback on some of these activities. We'll be back here probably for a shorter briefing toward the end of October. So that will be a good opportunity because at that point we expect to have gone through the financial data and policy review. We already have that most of that data in hand. And then we will also be back at the end of November. So this will be mostly focused on key findings, and we should have a draft report shortly thereafter. In this moment, we are coordinating a lot of data requests with Jill and other staff members to start to pull that information together. And then we're also in the process of stakeholder identification. So trying to identify who would be good to contact for interviews and focus groups and listening sessions. So I think one key takeaway is just to know that when we will be back, and then also to know to expect a draft report in the beginning of December. And because of the timeline, we'll probably have about a 2-week review period. So that was most of the information I had planned to share. I'm happy to take any questions about Save a Workshop or the evaluation plan we have so far. I also put on the slide a couple discussion questions. If any of you would like to weigh in, I don't think we have to walk through them in order, but these are a couple of points of feedback we thought would be especially helpful from this group. Just from the outset, helping us understand your hopes and concerns about this study, helping us become aware of other things that are happening in Whatcom County, what are pieces of context that we should be aware of, that especially those that might affect our timeline and deliverables. And then we're also inviting your collaboration in terms of identifying stakeholders. So given this fact that we're really trying to understand the process and provider experience, who help us prioritize or find names for interviews and focus groups. I'm going to put these questions in the chat so I can take the screen down and see all of you. And happy to take any of your remarks or questions.
Thanks, Vivian. Maybe I'll just rely on the chairs to call on people if there's folks that have questions.
I'm looking for raised hands and statements or anything in the chat, so. No one. Okay, I'm gonna call on someone. We can't let these people off. And I don't mean that in these people in a bad way, but come on, we have to, I'm sure they want our feedback. It would be helpful. Allie Bishop, you've got to have at least somebody that would be a priority for the interviews on the stakeholder identification.
Wow, I'm honored to have been called out. Thanks, Sally. I mean, that is one of the questions that jumped out for me was with stakeholder identification. When I joined this task force about 2 years ago, I was the only representation we had of a classroom teacher working with young children. And so I'm wondering about the diversity of the people, right? So, I mean, I think we talk about providers and we talk about families and we talk about children and we talk about community organizations. So I wonder if Vivian, you might speak to a little bit about that scope or if there's any ideas about that at this time.
Yeah, I think with the focus on the process evaluation, we kind of segmented it into staff. So all staff who worked on the Healthy Children's Fund, so on the program side, as well as those who kind of helped with the operations and finance stuff. Then we also think about providers being really anybody who applied for Healthy Children's Fund funding and or were awarded funding. We really want to learn about their experience and take from that what lessons can be learned for improvements. And then I think the kind of third biggest ring are families themselves. So anybody who has been affected by Healthy Children Fund funds, could be through interaction, like directly with a provider who's funded by it, or it could be maybe even more broadly, like you said, school families who just, you know, knowing that it exists is a boon. But I would say we're really most interested in those who have had some interaction with the fund, because the goal is to find opportunities for improvement. So how can we change the administration of it, or make recommendations about implementation and strategies, if that helps.
Yeah, that's really helpful. Thanks, Vivian.
To Vesla's question, it does include staff in the other departments. I'm not super familiar with the organization chart, but it does include staff who are working in budget and finance and legal, everybody who would be kind of implicated in creating contract templates, getting contracts written and sent out.
I have a question. I mean, I'm gonna straight up say my heart and my heartburn is that, you know, I think that the rollout of the Healthy Children's Fund, from my perspective, you know, was clunky and difficult in some ways for lots of reasons, and not because there aren't amazing, excellent people doing the work, but it just had its own its barriers to work through. And I'm curious about how my biggest heartburn is that then it's too early to truly assess what the true impact of the fund is when it's so early in the stage, and when I feel like it's just now hitting its stride in implementation, and how you might be able to take that into account if it's appropriate. I obviously don't want to make things up or have an agenda, but that is one of my concerns.
Thanks. Yeah, and I think it would definitely be appropriate to include just important context. Like, this is the length of the duration of the Healthy Children's Fund, really getting the timeline straight of when things happen, so that expectations are realistic about when certain things might be observed. And then I would also say that it would be, I think this is why it's super important that we get to concrete and feasible recommendations, so that it's not just retrospective on what was challenging, but it's also prospective in identifying that there are ways to be better.
And I'm sure you're already doing this, but I just, you know, I think it's easy also in the fund to presume that it's childcare providers. That would be your key, one of the key provider groups, but there were a lot of other groups that obviously received money, and, you know, food banks and maternal mental health and those types of groups that I just want to make sure you're that of course you're looking at the global impact, not just childcare.
I can share, Sally, that the SEBA Consulting or SEBA Workshop was provided with a list of every single contract we've ever done. And the service that was that they were, you know, that we were providing, or that the organization was providing with the Healthy Children's Fund's resources. So yeah, I appreciate that. So they see everything from, you know, the $15,000 we gave to More Smiles and Ferndale Child Care Center, to the $900K we gave to basic needs for the food bank. So they have a whole breadth. Go for it, John.
Will this study look at that comment? Just reminding me that we also put in ARPA money into a lot of childcare investments. And will this study look at any of those investments and the impact on the community?
I can have Jill and Vivian fill in after me, but my understanding is that this audit is specifically just for the Healthy Children's Fund.
Okay.
We could, I mean, never mind.
Yeah.
Sorry, Jill.
No, that's fine. Thanks. And that's correct. This is exclusively looking at the fund, and that's really kind of per ordinance as well.
But I do think Councilmember Scanlon's point is well taken, and that a piece of the timing and potential clunkiness of the rollout was impacted by the need to get that ARPA money out. So maybe that's to your question of context and timeline, but I see Allison Williams and Colton have their hands up. So I'll do alphabetical Allison first and then.
Yeah, I just think John's or Councilmember Scanlon's point is well taken in that I'm not sure how the evaluation can take into effect any braided or blended funding that either helped jumpstart something that the Healthy Children's Fund then funded, or the Healthy Children's Fund started it and then there's funding that came in behind to lift it up. So, because I think that's important for any funder to have the full scope, so they don't think, oh, we put in, $50,000 and look what we got for our money, when really there's some braided funding then that made a program more successful.
Yeah, I believe we'll be able to see, I mean, braided funding probably would not show up in the general ledger because it would not be like an explicit transfer into the fund. But I think to the extent possible where we can see that the Healthy Children's Fund kind of funded part of a program and certainly not the whole budget of a program can be called out. I will say there is another question in the RFP specifically that's a little bit in the other direction that addresses a question about whether the Healthy Children's Fund supplanted other funding. So, did you end up funding something that could have been funded by other sources is another key question that we'll be reviewing for.
Yeah, thank you, Vivian. I'm curious. So I know that Sarah had noted that you were provided a list of all of the contracts that we were awarded, but I'd be really curious to see if there's some potential to look at potentially providers and stuff who went through the process and maybe started negotiating a contract, but it ultimately didn't happen. We look at all the successes, but I'd be curious to look back and see, okay, where might have some things not worked out, and what are some things that we could learn from that. So just thinking a little more comprehensively.
Sorry, Colton, I excluded that. Every person who applied for any RFP or funding opportunity from the Healthy Children's Fund was included in that spreadsheet.
Oh, got it. Okay, sorry, I misunderstood.
Yes. No, that's okay. I forgot to share that.
Yeah, well then, yeah, that's my thing. I'd love to dig those, or contracts that went especially long. I know we've had some year-plus negotiations. Might be some good nuggets in there.
Thank you for that. Yeah, I think that definitely echoes something we heard from staff as well. So interested in getting to talk to those who did not or have not yet gotten to that contract stage.
That brings up another thing that I know led to some delays at the beginning. I'm thinking about the whole debate in this room and outside of this room about gift of public funds. And I'm wondering, will things like that be looked at, about barriers that we had as a county entity? There's been a lot of talk about how, we were trying to do something new, right? And various parts of the county government struggled to do something new. And I'm wondering if those types of questions and discussions will be part of this study.
I wouldn't say that's appeared in kind of the question list explicitly, but I feel like it's something that could certainly come up, especially when we talk to providers, because we are planning to explicitly ask about what were some of the barriers to implementation for both the staff and providers. So I wouldn't be surprised if that comes up.
Thanks, Vesla, you have your hand up.
Yeah, I have a question. Vivian, maybe can you share a little bit more about the sort of guardrails or processes that make sure that this is an independent audit in terms of like how much, obviously you need a ton of collaboration and information, but how much is up to the discretion of what you all find and the presenting of those findings and those sorts of things?
Yeah, I would kind of break it into two pieces. So the findings are happening independently. So SEVA workshop is working independently with the data. We're identifying the interview protocol, the final stakeholder list. So everything that you are all providing and the staff are providing, we're kind of making the final call on how to outreach and who to outreach to. I would say where the process gets more collaborative is probably in the recommendations development, because the Whatcom County side has better insight into what's feasible within their organizational structure, as well as helping identify. So we might come up with a finding about certain spending patterns, and with that data, the county can probably identify ways to implement. We can identify kind of like generically controls that can be implemented, but the county can take that a little bit further and talk about, well, this is how we could implement it within our organizational structure. There is a standard kind of general audit standards book that's kind of known as the yellow book. And I would say that that's kind of our touchstone for implementing the audit, though we are kind of taking a blended approach here. So since it's kind of part performance audit, part process evaluation, there are certain questions that are really up to us to do independently. So for example, when we're talking about did the county stay within the 9% administrative cap for overhead and 3% cap for evaluation and auditing? That's probably one component that we are going to rely on that standards for. But then there's other kind of more process-focused questions that will depend more on the county for partnership. Does that make sense? I think it's a little bit of a blended evaluation. So there's kind of the performance audit part, and then there's a process evaluation part. So we're kind of having to wear two hats at once. But as far as independence, I would just emphasize that it is our call in terms of the questions that we're asking, who we're asking, and the quantitative analysis methods that we're doing.
That is really great. Thank you so much, SEVA folks and Jill from the Executive's Office for coming. I am sure if we would like to continue, we can move some time around, but we are at the end of the time for that and should transition to jail planning discussion with Vesla.
Thanks, Sally. But actually, Colton is wanting to facilitate this one, so him and I talked.
Heck.
Yeah, thank you, Melissa. Thank you, Sally. I appreciate it. So you might recall at our last meeting, we had Heather, Executive Director for the Chalk and Net Health Foundation and a member of the Incarceration Reduction and Prevention Task Force, meet with us. And she provided a very great presentation, a lot of great detail. I'll drop the slide deck here, but it should have been shared with you all before.
Hey, Colton. Hey, Colton, you're a little hard to hear. Do you know?
Yeah.
Is it just us or?
Hopefully that helps.
Okay. Yeah, closer to the mic if you don't mind. Is
that better?
I wish.
Oh boy. Oh man.
Sorry.
Right, if I can turn off some stuff here. Hopefully.
It sounds like you're on a VPN. Are you on some kind of VPN?
I shouldn't. the test
It is
test.
a little, that's better.
Okay,
Yeah,
I
thank
turned off.
you.
You're good. I turned off echo cancellation, so hopefully there's no echoes now.
Okay, great, thanks.
Yeah. Anyway, sorry about that, guys. So as I was mentioning in our last meeting, Heather gave a great presentation on some ways, provide some context, of course, on the discussion that's been happening around the jail, kind of up until this point, and sort of criminal justice as a whole, and what can we as a task force do to kind of flex some advocacy muscle. And so she gave a great presentation with a lot of recommendations and potential avenues for us to take. And we, as co-chairs, thought it would be great to slot some time to debrief on that conversation. And it would be great to, maybe identify one or two areas that we can further explore. I did a little bit of work on the side, listening to that presentation, looking at our slide deck, and kind of prepared some information with the help of AI assistance. So apologies for any wonky wording or formatting on there. And so there's a document there that I just dropped that has some stuff. But I would just be curious to open this up for a little bit of a conversation and see where we might want to take that moving forward.
Colton, is the Google document that you've linked the one that was in the packet that got sent out by Allison? But I said that I might have been wrong.
Yeah, so the first link was the actual presentation itself, and then the second one is one that I just pulled together over the weekend. And so there's like five kind of areas that I pulled from that. Kind of looking at the juvenile justice system, how can we support that? How we can support children of incarcerated parents, and then also some work on like behavioral health and substance use treatment, and then the jail planning process. So,
do you want to share your screen, Colton, and then everyone can look at the document together, if that's okay?
Yeah, that's a great suggestion. Let's make that happen.
Thank you.
Mm-hmm. Hopefully we're sharing the right screen. Yes, we are. Okay.
Okay, sweet. Thank you.
We'll make this a little bigger so it's easier to see. Boom. All right. So yeah, these are just a couple areas that I pulled. We can talk about these further, but they're kind of just a start to the conversation, I suppose, since I know it's been a little while since we last chatted about that.
This is Susan from the Commission on Sexual and Domestic Violence. I can't figure out how to raise my hand for some reason, even though I've been doing this for like 5 years. I did last week, I think I met with Hannah Fisk from the health department, who's like the primary contact for the behavioral health stuff. And one thing that she said, just in general, but I thought might be useful for this discussion is right now they're planning the building and construction of the jail. So any feedback, I think a lot of these data things would be separate, like from what she was talking about, but if there's any feedback we have about space that would be needed in the jail for programming, that's feedback that they need sooner rather than later, because the architects are like working on it. So if we were like, something here seemed really important, like maybe we need a playroom for children or childcare overnight space. Not saying these are real, but like we should be advocating for anything that will impact the architecture and the construction like pretty soon, because they've hired the firm and they're going to start working things up. So things that are separate, like we were talking about, like breast pumping, like they can buy breast pumps and put it in the medical room. That can come later when they're talking about like programming and other support. So I don't know if that's helpful at all for thinking about how we want to prioritize things, but that sounds like where they are as far as time.
Susan, and again, who should we be coordinating with on that? Or who's working on that?
Hey, Colton, this is Sterling Chick from PHAB. I actually have a couple of things to say about that. Can you hear me?
Yep.
But we're having worked in mental health for quite a while. I had a chance to work with a lot of families whose parent was in jail or prison, and I heard a couple of things that really should influence how we might go about this on some levels, and how you support a family or as an incarcerated member. First one is that almost every parent didn't want their kids to see them in jail or prison.
Partly that was shame. Well, a lot of that was shame. The other one is that they mistakenly believed that the actual visit would be traumatizing. A little bit about that in a minute. But if someone who is a divorcing parent thought that, that would mean that they would never visit the non-custodial parent because it will all be traumatizing. Children are remarkably flexible about how they see their parents, what they're wearing, or where they visit them. So that, you know, the room matters a lot. How, you know, what, just like it does when you go to DCYF, and the parent is visiting the kid on a supervised visitation, all that stuff matters. The other one, which I guess I've had the unique experience of having been in a fair number of jails and prisons in Phoenix, Atlanta, and here. And I'll tell you, if you really, some places go, I know they don't want the incarcerated person to enjoy their life, but so the food is awful, their beds are awful, their places are, but I know how you design a jail to make it hard for families to visit. And I saw that in Phoenix, Maricopa County Jail, where you will go through 5 metal doors that have these huge clanging noises. The paint's peeling off them, and there's like guards right there, and there was a juvenile jail in Phoenix that looked just like, you know, Florence prison with high fences and things like that. And so of course you have to keep people in, but there are ways that you could get a kid in there without the actual going in being traumatizing. That to me is important. If I were recommend recommendations for them, is that they have a way of getting into it, just like maybe the way staff go in. It's not through the front door, and it's not, that wouldn't be the traumatizing thing. So that's my 2 cents about it. So I think those are important. First of all, for families whose parents are where the parent is incarcerated, some help with them working through their shame about that and their misconceptions about whether or not that would in itself be traumatizing to children, because it does not have to be. The separation is the trauma.
Yeah. I think what I would add too about the visiting piece, and I can't remember which room I was in, so I'm sure someone else in this room has better understanding about this, but foster care in Washington State has now mandated visits with families with parents who are incarcerated. And so they're now, as Susan, I think, is shaking her head, so maybe she knows more about it than me. Maybe you're the one who told me about it, Susan. Can't even remember, but it would be great because it is now a state mandated activity that there is actually a nice place for families to visit during those regulated visits. John, do you want to go?
Yeah, Sterling, thank you for that. That reminds us why you're here. And I'd imagine there's a few other folks who have some professional or personal experience with that. Maybe Susan, you know, with your work, I'm sure others as well. That's why I'm really glad we're having this conversation, and like someone said, it is timely. I see that Jill is still with us. Jill, I'm wondering if you have any thoughts on how to bring some of this experience in to the planning. What do you think is the best venue? Because I would love for some of the folks doing this work to hear more in depth from Sterling and from others about what they've seen over the course of their work.
Yeah, so I think I would probably, sit down and talk with Kayla about where folks could plug in and they could convene the conversation. I think it'd be the most efficient, especially maybe for Hannah's time and all that, to just do that, to convene that gathering. My limited knowledge is like, there's certainly not to that sort of design type of phase like that was mentioned. It's really, from my understanding, just like this list of making sure that these are things that are included. So I don't know if that helps the conversation, but I can carry this forward with Kayla and talk about convening on this very specific topic, if that helps.
Okay. And Jill, am I correct? Would it be the Finance and Facility Board is that the place where kind of more of these details are being discussed? in an open setting that someone here could join?
You know, Councilmember, I have to check. I haven't been involved in that specifically, but I can
Okay.
find out.
Okay, thanks.
Yeah, you're welcome.
You're right on that, John. I think it was the facility and advisory board that's responsible for that line of work.
Yeah,
So, okay, perfect. Well, it sounds like there's some immediate interest and need to make sure that this is being addressed in the planning. And Jill, it sounds like you would be interested in helping us bridge that gap and getting connected. Is that what I heard?
You bet. I'll bring it up and report back.
Wonderful. Thank you so much.
Yeah.
Perfect. All right. Well, I know we have 2 minutes left in this conversation, but maybe we can extend it just a little bit potentially. I'm curious, people's thoughts. I know we have a couple other items here. Anything else kind of for folks? John, see your hands up.
yeah, Colton, I also see in here, there's discussion about the prosecutors. I think reaching out to the prosecutor's office would be helpful here. I see the, point up top about bringing in Sheriff Tanksley and Lieutenant Erickson. I think that's great. And I also think about how our prosecutors make decisions that impact children and families. And judges. That was the other place I was gonna go. And the other thing to remember is that generally in these meetings, we have representatives from the executive's office or the executive branch of government and the legislative branch being council, but our prosecutor is an independently elected officer and all of our judges are independently elected. It's one of the tricky things about county government, all of these power centers we've set up, but I think in order to bring the concerns of this group into how prosecutors do their business and how judges make these considerations regarding families and children, I think it would be helpful to bring them into our meetings as well. So we could put that on the task list for who else we want to invite.
So we're at 4:30. Colton, is this discussion of a piece with next task force issue to dive into enough that we could dovetail that into this and then maybe push task force report to council and subcommittee updates out a bit and the report to council out a bit, starting those around 4:45?
Yeah, I think that certainly makes sense.
So let's go ahead and talk and continue this discussion on, we're under the area of, I keep swatting like this. There is a fruit fly in my office. I really should have got my garbage sooner. That's what's going on with the hand movements. Okay. So we are in task force jail planning discussion still. One thing, Colton, in connection with your document is it's awesome, and it also feels like a number of things. It feels like the new issue as well as the jail piece of it, which is awesome because I think that's where we all want to go in it's all together, but the jail feels to me the most imminent because Susan was saying, like the time is now for a lot of these things. And there's also these other things that are relevant with relating to county policy that is within the scope of the task force to be making recommendations on. Is that an accurate statement, Colton, that your document is more than just the jail?
Yeah, for sure. I figure the jail planning is both a short term and a long term, and that some of the first items 1 through 3 are some intersections there. So yeah, it was just meant to show all the potential things that we could chat about. Not saying we need to hit all of them, of course, because we are while we are a mighty body, we are not an infinite group of folks. So I think we're just looking to figure out what we can prioritize right now. What do we want to work on first? And which sounds like the jail is pretty pressing. And also identified some areas so that, moving forward in the months along, we can start to figure out how we could learn more about these things and where those opportunities might be. That's just how I conceptualized it, at least. The other thoughts?
Yeah, this was probably already answered, but again, I will go back to feeling really overwhelmed by the jail specific issue and feeling like planning is happening, things are happening, and yet nobody knows when the public comment is, or maybe that's not within our role, and that there are going to be windows of opportunity that we're not going to know about. So I guess I'll underline what was really already asked of Jill is if we can be informed of appropriate places where we can know that we can present on. I mean, I think as this body, we always have the ability to at least go to council, but
I think this is Jill. So I think I can absolutely be the conduit to knowing when you can supply comment. My understanding right now is we are so far in the initial stages of just scoping even size. Like we are so at the beginning that I don't want people to feel as though they don't have time to have these conversations or submit these types of things and discussions. So I'm happy to make sure that there's the public comment part and when it would address your concerns. Does that make some sense?
yes, I'm also seeing council members on the statement of every other Tuesday at 6 p.m., which yes, is public comment. I believe. Good point. Susan, you have your hand.
Yeah, I just will say, I know people are busy. When I met with Hannah Fisk, I think she would. Okay, so the difference is after we had the presentation from Kayla and we had the presentation from Heather, and then I'm talking to other community partners and we're like, but what, that's the high level. And Hannah's showing me pictures of what they're thinking about for wall color and housing pot. She has that direct line stuff, and she has a presentation that she was like, oh, I have 5 presentations the next week. I think it depends if that's the level we want, but if we want to know what's actually happening, I really felt like she was texting Caleb Erickson while we were meeting. There were some things she had answers to, ways they're thinking about supervised visitation. There were pieces, yeah, Allison says she just did one today. There are pieces that in that meeting, I was meeting with her with Moonwater from the Dispute Resolution Center. We were advocating for that place where children could see their parents in the same space. Apparently people hide things in diapers and things. But we were it'd be really great though, as if a parent could touch their baby, because a window doesn't really do it for the baby. But that's all, I think it's all things that she was like, the more feedback I get about this stuff, the more I can advocate for it and ask the people who are planning to say this seems really important. So I don't know. It was enlightening. I told her I just feel like I'm hearing all this stuff. We don't know when to give feedback. I don't feel the need personally to meet with her yet, but I think there might be things that we'd want to know, what she's thinking about children, and some of the things Sterling, you brought up, how are we going to make sure that the designs that children will feel comfortable and parents won't feel like they're locked up in a cage when their children visit them, right? So I don't know. That's my own opinion. I already got to talk to her, so y'all can decide if you want to hear from her.
Thank you, Susan. All right, does anyone else have any other thoughts on this discussion? If not, it sounds like a good next step is co-chairs and I can work with Jill to see what we can get up on that front. And if we can get a chance to talk with Kayla, that'd be great as well. And we'll just keep you in the loop as there are opportunities for us to kind of make some action here, and we'll keep you updated.
Okay, Colton, well, then we will move on to our next agenda item. Do you mind taking down your share screen, and then we'll have bigger pictures of everyone. So task force subcommittee updates from the subcommittee leads. Go. Colton, you're a subcommittee lead, aren't you?
I am, yeah. I suppose a lot of subcommittee leader for the accountability committee. We haven't done a ton. Actually, I do have something for y'all. I did mean to bring this up later in the next task force issues, but this is actually a great time to bring it up. So you might recall many months ago, we had provided recommendations to the comprehensive plan review, last year. They have released their draft for chapter 7, the economic development chapter. That's where childcare issues were sort of talked about. And so of course, I've been keeping an eye on this for months and months. And when they put out the docket that they were going to talk about it and then passed it, I was out of country. So of course I missed it during the one time I was gone. But there is a draft available for review. I'll drop a link in the chat right now so you all can take a look at it. And if it helps to share my screen again, I will do that. This is the plan. There's lots of markup here. They made 2 changes that were to the comprehensive plan that concern us. You'll recall that one of our things was to talk about planning and policy, permitting. They've included a small mention in the plan to ensuring competitive review of policies, taxes and fees and processes that concern childcare. That's a new addition. So they don't go into a ton of detail about what exactly that will look like. That definitely seems to cover many of our recommendations in this section around ways to improve processes for childcare providers and whatnot. And really notably, we did get a whole inclusion here in policy 7C to recognize the importance and the importance of available and affordable childcare for workers, increase access to quality and affordable childcare by supporting local efforts to expand childcare affordability as a foundational element of workforce development. And then they specifically note to consider the recommendations that we made. So again, it's a little high level, but it's great that we got a specific mention in the report. I will keep you all up to date. I know there will be additional public comment, and John, feel free to weigh in here. I'm sure you know a little bit more about that at this stage, about how we can continue to influence this if we find that there is a need. So yeah, if anyone has any thoughts there, that's my update.
Thank you, Colton. I, for one, am super appreciative that you went through this, thought about it, and Councilmember Scanlon has his hand raised.
Yeah, Colton, this is on the council agenda for tomorrow afternoon for the committee of the whole. It's not the last chance at this, but if there is anything that you're aware of that you'd like to get in there, if there were any recommendations that were missed, let me know. And I can start on that tomorrow, but it's not the last chance. There will be multiple opportunities ahead. And just so folks know, the timeline on the comprehensive plan update is that the planning department director, Mark Bersonius, has been telling council that the likely final adoption won't come until early next year. So probably February, which also means that we know, and I've been telling people this from when they first said that, next year we're guaranteed to have 2 new council members, given elections this year and open seats and primary outcomes. So on a lot of this stuff, you're also going to have at least 2 new council members who are going to have their own ideas, and coming in from, you know, day one, they're going to have to get up to speed very quickly on these things. So that's something else to keep in mind on the comprehensive plan for next year.
Well, thank you, John. I'm just really curious, and I don't mean to take up a ton of time here, but to kind of provide some context about how this plan is used. I know that a lot of things noted here seem very high level, a little bit vague. I'm just curious how the county actually uses this plan, and how can we tie in the more specific policy recommendations that we made in the memo now that, well, they'll hopefully be included in the final draft. Now, how does that change the work that we do here.
Yeah, like you're saying, it is, some of these things are high level in some sense, and some of these things are aspirational. But I think one thing that's helpful in getting something into the comprehensive plan update is that it kind of gives you a hook to continue to work on that. So even if it is something that's aspirational, I think we should try to get it in there, get it in there. Because then that kind of gives a reminder to the county as a whole that these are things that are important to us. And these are things that we want to continue to work on. You could go back and look at the comprehensive plan that's in place right now and think about, did we do that in the last decade? And there's a lot of things that we haven't gotten around to because it's subject to funding as well. So that's how I think about it.
Will the new planning director change over before the new comprehensive plan is complete? I can't remember when his retirement date is.
Yes, and that position's open right now.
So he will have retired before the comprehensive plan is
I think
complete?
the plan is to have some overlap, like there's been with some of
Okay.
the other recent job changes
Oh, that's
in the
nice.
county, is to have some overlap
Okay,
in between, but yeah, the new planning director will be in place. Well, as long as this round of recruitment goes
Okay.
well, the
Okay.
person who
okay,
is selected at the end says yes, the idea would be that that person would be in place before
okay,
council approves. the
Okay.
plan.
okay.
Okay. Well, thank you, John. And I guess if anyone's available tomorrow at 1 p.m. and you want to go give some comment as a private citizen, feel free to do so.
Actually, Cole, we won't have public comment during that session. What I was suggesting was if someone wanted to start to get something in there, let me know overnight. And I'll put that in my notes for making a motion tomorrow to get something in. And if it's, I know that's a short turnaround, so there are opportunities to get this in the future, so let me know.
Thanks, John.
Bessa, do you have an update on the Healthy Children's Fund Subcommittee? And it's okay if you want to just say we were gonna recommend a letter to send on the BTC issue, but Sally didn't get the memo draft done. I'm willing to fall on my own sword.
I think you just did. I wasn't at the last meeting too, so I can't give an update, but maybe someone else can. Allison, were you there? Tilda, did she get one? Oh, she wasn't there either.
I wasn't there. This is the one just last week. Yeah.
So it really was to think more, to make a recommendation to the committee, to our task force as a whole, I guess is the better way to say it, on thinking through the BTC comments on the that plan, their experience with the county, and come up with a memo that that the subcommittee is going to present to the council, to the task force, to present to council and the executive's office potentially, but more discussion, more to come on that piece of it.
Yeah.
I think that's all of our subcommittees, correct? Okay, so we're really 5 minutes. So now we are on task force report to council. Who would like to go to council? It is not tomorrow, correct? It is now pushed to October that we will present, Colton.
That's correct. October 7th. Time TBD, though generally afternoonish at some point. It's pretty simple. It was a relatively short report, so it shouldn't be a huge lift. But I'm happy to try to be there myself. But if we have a couple folks who also would be interested in getting in front of council, this would be a great opportunity, especially any new folks who haven't had a chance to do it yet. Always love to get new people in.
I can go with you, Colton.
Perfect.
Will you send me the specifics?
Yeah, once we have a date or a time rather, I think those come out a couple weeks before the actual meeting. I can get everyone in an email and we can work on a script or talking points or whatever.
And I believe you guys, the we just checked for the minimum amount of time, so 15 minutes. That's the minimum, isn't it, John? 15? It's not 10.
That seems like it should be plenty.
Okay, great. That's what Colton said, so great.
What's the date on that again?
The 7th of next month.
All right, Colton, are you good on that? You and Tilda? I think 2 people is enough, but more are always welcome.
Yeah. I think that's great, great set. And Allie, I see you checking your schedule. So if it works, let me know.
I am, as if it's between 1 and 3 p.m., I might be able to do it.
Perfect. I'll, once I know, I'll let you know. Thank you.
Colton, I meant to suggest that as a new task force issue to dive into, and we have a little bit of time before we throw it to public comment. We have 5 minutes. The state legislature implemented two changes to that requires cities and towns, I believe, and certain kinds of cities to require that childcare be allowed in all zoning except for industrial, I believe. I don't know if it's allowed in light industrial. I also believe that there was a building code requirement that has to be implemented that makes it easier to get certain ratios. I don't fully understand it. At any rate, that state law change did not apply to counties. But it would seem appropriate that the same zoning requirement apply to a county as far as a change in allowing more flexibility in zoning to where a child care center could be at. And so I thought that it might be a new issue if it's appropriate for the task force to make a recommendation to council that an ordinance be changed to allow for that.
Yeah, thanks, Ellie. I appreciate you bringing that up. That's and for sending it to me earlier. I know it really ties in really well to a lot of the conversations we've had with the Healthy Children's Fund, and I believe we had someone present almost about this exact thing a couple meetings ago, right?
I think so, and it may be that I just put or asked to be on the agenda at some point to potentially present on how we might make a suggestion to council on it if we can get buy-in, because I did see Representative Lovelet at a thing and rudely went up to her and asked her why it didn't include counties. And I guess I got the sense of don't let the perfect overwhelm the good, that it was more what they could get through, but that it can be used as momentum for counties. And then I'm trying to talk to people who would know how to change an ordinance and all of that. So putting it out there for you to put on your list, but I'm also on my own trying to work through how that might be done. Seems like an easy yes vote to me, right, Councilmember Scanlon? He would totally vote yes for this. Anyway.
So.
Yeah, okay. So let's just finish early if we can. Or other comments.
Can I make sure that Heather, our newest member, gets a chance to introduce herself? She's here in person today. Thank you. Heather, yeah, please.
Yeah, no, thanks. Hi, everyone. I'm Heather Carson, and I also want to say thank you to Councilmember Scanlon for helping appoint me to the vacancy role. So I'm thrilled to join the task force team. I would love to meet with many of you for coffee or just to kind of touch base around kind of your focuses or your issues. Just a little bit briefly about me, since I'm probably pretty much an unknown for Whatcom County, as my husband and I moved to Bellingham in 2022. I'm originally from Edmonds. My husband's from Whidbey Island. I went to WSU and did my Master's of Ed at UW-Tacoma. I did my Master's of Public Affairs when we were corporate nomads, so we've lived in rural Mississippi and rural Indiana, and my role in Indiana for 10 years. 6 of those years I was director of a county coalition for youth and family development. So I'm excited to serve with you and hopefully maybe bring some experiences from other places to benefit our local young people and their families. So thanks for allowing me to be a part of the task force, and I'm thrilled to serve for the next couple of years. Thanks, Heather. Yeah.
Thanks for applying.
Thank you.
So amazing. How lucky are we to have you? Thank you for doing it. That's, yeah, awesome.
Great.
Tilda, did you kind of raise your hand? No, you were just like brushing your hair. Okay. Oh,
Thanks, Heather, and welcome. I'm wondering if Jill or maybe Sarah or anybody really might be able to give us a short snapshot of the incoming health department director, or what can tell us a little bit about them, or how, if you can, what to expect, or anything you can about that before we switch to public comment.
I bet Jill was a big part of the process. I got to meet Champ, but I've just had a few brief interactions with him.
Sure. I think there's a press release. There might be some articles in the paper I could maybe try and drop into the chat, or Sarah might be better at finding that, and that people can just link into to tell about him. But Champ Thomas Cuddy is going to be here at the end of October. We're super excited. They're relocating. He and his wife are relocating from Maryland. He currently is the health director in a large system in Maryland. He is, his resume includes he's an epidemiologist by trade, has been working in public health for quite some time. So we're all super excited to have him here. Of course, as you can imagine, it takes a little bit of time to make that transition. And so that's why it's going to be the end of October before he joins. So if that helps share a little info.
I'll just share really briefly. Something I liked about him was that he clearly had like a very broad understanding of all the services that a health department and community services division department of our size would understand and do, but also had some really great perspective about running a large organization. So it was like he could touch down and be a touch point around details, but also understood when it was time to scope out. And I really appreciated that for the role that he's going to serve.
Yeah, I agree. I was part of 3 rounds of interviews with the candidates, so interviewed Champ 3 times. I think he'll be a great fit for us. And he specifically mentions the healthy children a few times in this process, you know, about something that's unique when it comes to our county, something that was attractive for him, looking at the job that our community has committed to $100 million over 10 years to support the youth of our county. So, you know, that was the kind of thing that attracted someone to this job, which is good to know.
I also think he's funny, which is nice for me, you know, that he'll be my employer and he's funny.
I just dropped the press release into the chat, so you have a link there.
Thank you.
okay. We now have time for public comment. I don't know. Yes, it looks like we have at least one community member here for public comment. It's because you are here, you don't have to make a comment, but okay. Well, 3 minutes early. We're going to adjourn. It's
Sally,
enjoyed.
can I say one quick thing?
Yes, please.
Okay, this is something that my fellow council members and I are doing in every meeting, is to talk briefly about the county budget. So I'll put a link in the chat there. The county budget's on 2-year cycles. So last year we approved the 2-year budget. In the middle of that cycle, we take a look at the budget, how things are going. What does revenue look like? What do expenditures look like? So that conversation kicked off at a recent council meeting. And so at every council meeting, the through November, there'll be conversations about the budget, and council will likely approve changes to the budget in November. So I put a link in the chat to the biennial budget information, and what you'll find in there is there are notes in there for every county department. So you'll be able to see what's being proposed for any additions or cuts or changes to county departments. And so just for context, you know, what we know that, you know, something like the Healthy Children's Fund is in pretty good shape, right? We know there's work to be done on our spend rate. And I think, you know, getting through the subsidy program is gonna help a lot with that. That's what I keep telling folks, but a lot of our other funds are having challenges. Some of these are kind of structural, and you're seeing this across local government all across the country. City of Bellingham is having some issues right now. So new things outside of the Healthy Children's Fund are going to be very difficult for the county. Some of the drivers of that are that counties in Washington state are limited for the most part to adding 1% of new revenue when it comes to property tax. A lot of our funds are funded by property tax. If you think about that 1% every single year, inflation over the last 2 decades has averaged over 2% a year. So we're not even covering the cost of inflation. And in a presentation from the executive's office in our council meeting 2 weeks ago, we talked about how projecting out over the next 4 years or so, inflation will cost our county about $4 million a year in the general fund. And then you can take that out for the other funds. The other thing that adds to cost, and I think it's a good thing, is that we tend to pay our employees cost of living increases that average about 3% a year. So you think about that 3%, you think about the 2%, and over the past few years, much higher than 2% inflation. We're having these issues where, for various reasons, our state and voters in this state have restricted counties and how they can raise revenue. That's gonna cause challenges for us in the future. So even to be able to maintain current levels of service, the county is likely gonna have to continue to do the 1% increases, and that will be difficult to maintain our current levels of service. So that's kind of the overall big picture of things. There are some potential revenue sources for the county. The executive's office took a really fine tooth comb look through every county department, and the independently elected officers have done the same. So you will see in there are some cuts that some offices are making or projecting to help keep things in line. So you'll see that in there as well. So we're looking at both. What are the cuts? What are the ways to increase revenue? Now, most of that is for things outside the Healthy Children's Fund, but it's just for context for folks. So take a look. There should be some more public hearings on this throughout the fall so that folks can weigh in with council on what you think our priorities ought to be as we assess the budget.
Super uplifting, Councilmember Scanlon. Thank you for putting us on such a fabulously high note. Okay, tongue in cheek. We know what our missions are to be looking at this and going to public comment as needed. We are at 5:01. We are adjourned. Happy first day of fall, everyone.